Hi, everybody. My name's Jonathan. I'm a nurse practitioner student. I'm a registered nurse. Once again, a little bit of background. I was extraordinarily busy this summer and this fall. Did a lot of pediatric clinicals, 270. Did a lot of family practice clinicals, 270. So I'm going to talk to you today about Tylenol and Advil and Aleve. Remember that these videos are meant to inform. These videos are meant to make me a better nurse practitioner and make you a better patient and a more informed person. So I'm going to try to give you as much information as I can, but be aware that in this video there is math. Whew. All right, so I'm going to try to figure out how to include this into my presentation. I had to make this for class. This is Tylenol, Advil, and Aleve. So if you want to take a screenshot of this, I'm going to try to include it, but just in case I can't, use it, print it, take a screenshot, and we're going to talk about Tylenol, Advil, and Aleve. Okay? So Tylenol is also called acetaminophen. The general dose, right here, okay? 5 to 10 milligrams per kilogram by mouth every 4 to 6 hours. A 12 years old and older, you can do 325 to 600 milligrams. These are recommended by both the American Academy of Pediatrics and UpToDate, which is a very good research website. The age, do not give Tylenol under 3 months of age unless directed by a physician. Older than 3 months for Tylenol. Infants that are under 2 months of age, so anybody under the age of 2 months that has a fever of over 100.4 is urgent, and they need to go see a urgent care or an emergency room. So that is that information right there. Okay. Advil is also known as ibuprofen. The dose is 5 to 10 milligrams by mouth every 6 to 8 hours. If you are 12 years of age or older, it is 200 to 400 by mouth every 4 to 6 hours. It can cause gastric upset, stomach upset. And the max dose for Advil is 2,400 milligrams per day. The max dose of Tylenol, some people say 4,000 milligrams per day. Some people have reduced that to 3,000 milligrams per day. Advil, do not give under 6 months. Advil, do not give under 6 months. It can cause ringing in the ears for those that are under 6 months or any pediatric child. And of course, stomach upset or bleeding. And that is that information right there. Okay. Aleve, naproxen. Aleve is also called naproxen. The dose is 1 by mouth every 8 to 12 hours. You do not take more than 3 in a day. You do not give Aleve to anyone under the age of 12. It can cause increased stomach bleeding risk, upset stomach. It is a very strong medication. It's stronger than Advil. Aleve is stronger than Advil. And that is that information right there. Okay? Here's the math. Oh. So if I had a 50-pound child, in order to get the kilograms, I would divide it by 2.2. Okay? I would then take that number, which is 22.7, and remember it was 10 milligrams per kilogram. I would make a ratio, I would cross multiply, and I would get 227 milligrams. And then this ratio is right there. On every bottle, you will see a ratio. Oh, come on. You will see a ratio on every bottle. This bottle of acetaminophen is 160 milligrams for every 5 milliliters. So then you once again create a ratio. You cross multiply. 227 times 5 is 1,135. I can't read backwards. You divide that by 160, and so then you get 7.1 milliliters. Now, taking 7.1 milliliters is kind of ridiculous, especially because the adult dose is 325 milligrams to 650 milligrams. Remember, you're sitting at 227 milligrams for a 50-pound child, so you're just under the adult dose. Don't take 7.1 milligrams. That's ridiculous. Take 7. There you go. So, once again, to summarize, acetaminophen is Tylenol. Advil is ibuprofen. Here is your dose range. Here is your age. Here are the adverse warnings. Here's the math equation. So same thing, same exact thing. If you have a 30-pound child, do the same exact thing. Divide it by 2.2, multiply it by 10 for Tylenol, then figure out what the ratio is. If you want any more information, consult your pediatrician. Go to an urgent care clinic if you think it is needed. Anything over 100.4 for a 2-month-old is urgent. The standard fever is over 101. 99 is not a temperature. 99 is not a fever. Thank you very much. Appreciate it. Hope everybody learns something. If you want to donate, I would be more than happy to accept your donations. Comment below, like it, enjoy it. I'm just under 9 minutes. Thank you very much. Bye. Bye-bye.